Good afternoon. My name is Abhishek Agrawal. I'm the Chief Business Officer for Birla Fertility and IVF. Today, Birla Fertility and IVF announces the acquisition of Baby Science IVF clinics. With this acquisition and this partnership with Baby Science IVF, Birla Fertility and IVF now operates 50 centers across 18 Indian states and 32 cities. We are among India's top 3 fertility and IVF chains now, and India's fastest growing IVF network, known for our industry leading pregnancy rates and compassionate care that we provide to our patients.
Sir, how many centers you are going to expand in Karnataka?
The plan is, after joining hands with the Baby Science team and Dr. Manjunath, that we build on what they have created so far, and we operate today 7 clinics of Baby Science in Karnataka. The plan is to add and go deeper into towns and cities of Karnataka in tier 2 and tier 3 towns, and add another 4 to 5 centers over the next 12 to 18 months.
Myself, Dr. Manjunath, Medical Director from Baby Science. I'm happy and thrilled to announce this partnership with the Birla Fertility and IVF centers. So I'm happy to say that Baby Science with 12 centers, 4 in Bangalore and across Tier 2, Tier 3 cities in Karnataka, and another few centers in metros, is joining a bigger group of Birla Fertility and IVF, which comes with a lot of patient-friendly, research-based services. So we, as Abhishek has rightly put, so we are committed to enhance these services to even more deeper areas with more technology-based and patient-first approach. Thank you so much.
See, success rate is, while as a statistic, if you look at it, it is one number, right, which we all want to understand. But if you really want to identify the right number, it is defined, it is a result of many variables. Because for each couple, the chances of their pregnancy will be evaluated differently, right? And when Dr. Manjunath was answering the other question, he did touch upon this, that a couple which is very advanced in age will have a lower chance of conception despite IVF treatment versus a younger couple. And then their underlying health conditions. Do they have previous history of miscarriages? Do they have other gynecology issue, right? Their BMI or obesity. All of this contributes to chances of conception for a couple. What we follow as a practice in Birla Fertility and IVF and in Baby Science IVF is customized treatment plan for every couple. You cannot have one treatment or one protocol which will be sufficient for every couple. Every case is different. Every couple has a different underlying health condition, and it is treated that way. Fertility as an area, right? And fertility as an issue that we need to, infertility as an issue we need to solve. IVF is just one treatment option, and usually if you talk to the doctors, it is the last treatment resort. There is a lot of smaller interventions which doctors try for the couple to be able to conceive and help them to conceive. And that is why we at Birla Fertility and IVF, our focus is to treat the couple. Our focus is not to do an IVF. What it means is sometimes there is nutrition support needed. Sometimes there might be smaller procedures like intrauterine insemination or other sorts of interventions which can help the couple conceive on their own as well.
And Abhishek, we provide.
We are seeing the couple who are coming to our clinics will be not in below 30s. Usually they come at least 50-60% of the couple are above 35 and above. So when they come little in that category, so the conceiving chances will be little less because of the age factor. Their egg reserve, the egg quality will be less. So, and even for men also, as they age more than 35-40 years, the sperm quality will come down. So they find more difficulty in conceiving naturally. So those kind of patients are coming in large number to our clinics. So that may be because of change in the societal norms, delaying their pregnancies, delaying their marriage, focusing more on career. So those are all factors are contributing to the increased age when they seek for a fertility treatment.
But I want to ask, was correct. See, I think we have to understand age in little bit of brackets. For a woman, fertility drops very drastically. Chances of conception drop very drastically after 35 years of age. Between 30 to 35 years, the decline is steeper, but after 35 it rapidly declines. For male, it is less accentuated, but it is still there. The decline in fertility is still there. So yes, age is a factor. What Dr. Manjunath was trying to say, why are we seeing a lot of age-related infertility? But this is a multi-dimensional problem that we see across the patient cohorts. So it's not just change in societal norms, right, and behavioral patterns that we see in India. It's also the nutrition. There are a lot of environmental toxins. It is also a lot of lifestyle-related impact on infertility, right? And you see substance abuse, smoking, tobacco, all of this takes a toll on fertility for both men and women equally. Then neurological disorders, right? And actually diabetes, obesity are also major contributors to infertility in a couple. So there are various factors beyond age as well which lead a couple to find a difficult situation to conceive.